Today we're going to talk about preventive care. So things that are covered under preventive care are things that you're having done just because it's the appropriate time and it's not because you suspect something is wrong. Things like this include taking your children in for an annual exam, getting immunizations for your children and sometimes for you, flu shots, for example. Immunizations that are just for travel and aren't in the standard recommendation aren't usually going to be no charge. So just be aware of that if you need a malaria shot. They are going to cover things that are appropriate for your age and stage in life. For example, I'm not 50. They're not going to pay for a colonoscopy for me. They're also not going to pay for a mammogram because I'm not old enough and I don't have a family history of breast cancer. So some of the things you have to consider is if it's medically recommended. The other thing you have to consider is frequency. If you go in January and have a metabolic panel done as part of your annual exam, and then you go in again in November, they're going to go, you don't need to do that twice in a year, guys. Come on down. So you have to make sure it's medically appropriate, that the timing is appropriate, and that it's something that is necessary to prevent illness and is not treating an illness. So those can also include things like nursing bras, breast pumps. You can have birth control covered in certain plans, and certain medications actually fall under this as well. So sometimes preventive care is covered if it's the appropriate timing and the appropriate stage in your life.